Okay, folks, hello everybody. Welcome those on Zoom to Phoenixville Public Library. We are live in our community room with local veterinarian Dr. Ann Caulfield and her presentation on pudgy pets. If you have a question for Ann during the presentation, please feel free to type it into the chat. I will be monitoring the chat and can relay the question to Ann. At the end of the program, though, you can feel free to unmute yourself and ask questions at that time. All right. Without further ado, we welcome Ann Caulfield.
Yay. Hi, everybody. Thank you for joining us online, and we have an in-person guest here as well. I know it's a little brisk evening, but I appreciate your interest in the topic. It's one that's near and dear to my heart. Super important topic. Big problem with our pets and our people as well. So we're going to be going over kind of the parallels. Let me just...
Yeah, you got to point it at the laptop, right?
Oh, there you go. Okay. So this is a little bit of a summary of what we're going to be looking at tonight. So really is obesity, overweight, really is an epidemic. I actually recently attended a human medical conference on the topic of lifestyle medicine, and a lot of it was about this obesity epidemic in people. So a lot of the information that I have in here regarding people, I'm not a human healthcare professional, but a lot of the information was pulled from that conference that I was recently at. Very, very interesting. So we'll talk a little bit about the parallels. Some of the things I think you'll find surprising and some not so surprising. Why is this such a big deal? And we'll delve into some of the whys and the hows of, our little pets get overweight. And then what we really want to focus on is how we can make you, as the pet parent, a supersized hero, because you really can literally save your animal's life, and certainly make them healthier and more comfortable. So I want to start with it's like a 5 or 6 minute YouTube video, get this working here, and just to kind of give you a feel of, what can the successful weight loss program and what that can bring and how important that can be to the well-being of an animal. All right, so hopefully you enjoyed that and found that as inspiring as I did. Kai was an exception with that massive amount of weight, but unfortunately he's not, the odd exception. Every day in practice I see animals that are significantly overweight, that are just really having a difficult time and struggling, and one second, trying to get
The down arrow.
Yeah. It's just me and technology, it just doesn't.
Is it not moving now?
Yep, I'll just do it from the clicker. Okay. So yeah, hopefully you found it as inspiring as I did, and we can learn from that. Most of you aren't going to have a pet that's as overweight as Kai. But it just shows you what dedication and love can really do, even with that massive amount of weight loss.
There's a chat. What a fantastic and heartwarming and motivating story. Yes,
yeah,
inspiring.
Absolutely. Yeah, I appreciate that. And that owner really needs to be just congratulated. She was committed, and that's what it takes. And she was dedicated, and she knew what she had to do, and she did it for him. And in the end, it's just amazing how he turned out. So as I was saying, parallel epidemics here. In the human world, these are Center for Disease Control statistics, and they're sobering. We're talking about people. There's my little group of peeps in the bottom there. So to date, nearly 75% of the United States adults are considered overweight. 42% are considered obese, 14% of children between the ages of 2 and 5 are considered overweight, 20% of teens are considered obese. So just staggering, and projections for 2030 is that 50% of the United States adult population will be considered obese. And it's not just the United States, it's pretty much, we're seeing this in, all developed countries, but even those that are lower and moderate income countries. So it's just kind of spreading. So we flip over to my patients. The Association for Pet Obesity and Prevention is an organization that for several decades has been studying this trend in our veterinary patients. 60% of cats now are considered overweight or obese, and about 56% of dogs as well. And over the past 10 years, there's been a huge increase in the rates of obesity, percentage of obese pets coming in to veterinary offices. Timely cartoon. Going back to our human statistics, 50% of the adult population diabetic or pre-diabetic. The staggering cost that these mostly preventable diseases has on the healthcare and on the economy is just amazing. And most of these, or many of these, are at least in part related to being overweight or obese. So staggering numbers. And here's really kind of the eye-opener study that was done several years ago by Purina. Very well done study. This study had a large number of dogs, which is good. They were Labrador retrievers. They took them from neonates or puppies all the way through their whole lifespan. And they designed the study so that they had litter mates as kind of controls. So one group they allowed just to eat, free choice, like many of us do with our pets. So they ate when they wanted to. And then the other group, they just sort of slightly controlled the calories. They were kept lean, healthy, not underweight. It wasn't a drastic reduction in calories, but they controlled what they ate. And what they found was really pretty amazing. So the time of onset of diseases like arthritis, osteoarthritis, 3-year delay in onset for the dogs that were considered lean healthy. And the severity of that arthritis was much less in those dogs. There was a 2-year delay in just the kind of the natural loss of lean, healthy body tissue that we see happening in the aging process. Took 2 years longer to start to see that in the lean, healthy dogs. And then the big thing, just amazing, is that the dogs that were kept lean, healthy, lived on average 2 years longer than the other dogs. And what really the study, what was shocking about it is they were not significantly overweight. They were slightly to moderately overweight. So certainly not anything like high, and hazard a guess, not like a lot of the patients I see that are significantly overweight. So it just sends home that message that even a few extra pounds can really negatively affect the health and well-being of these animals. They've done quality of life studies that measure vitality and emotional health, anxiety, certainly pain. And study after study shows that being overweight and obese definitely has negative impacts on these parameters. So they are, I call it silent suffering. These little guys, they can't tell us how they feel, but they are suffering. So this is a complicated topic, and it's a complicated disease. A very simple definition for obesity is just, accumulation of excess and abnormal, body fat, which promotes a risk to health and increased mortality. One of the big, again, very complicated, but one of the things that we know now is that fat cells are not just benign little energy storage cells. They actually are very active biochemically. They secrete a lot of pro-inflammatory chemicals, mediators that end up producing a chronic inflammatory state in the body. It's the #1 form of malnutrition. Obesity is the #1 form of malnutrition in companion animals in this country. I would hazard a guess that's true in people. Again, not a human healthcare provider, but I would suspect it's true. And it's 100% preventable. These are just a few of the diseases that we see associated with extra weight, being overweight or obese, certainly. Diabetes, osteoarthritis. I'm going to talk just a little bit on that one because it's so common. Diabetes, super common in our overweight cats, but we can see cardiovascular and respiratory diseases, collapsing trachea, pancreatic disease, skin problems. These poor animals, they can't groom themselves, so they end up getting soiled and skin infections because they're not able to groom themselves properly. Cancers, breast, or we call it mammary cancer, bladder cancer, but certainly there's being looked at in the human world the link to other types of cancers as well. Chronic pain is just a given with being overweight. They're exercise intolerant, liver diseases, heat stroke, increased anesthetic and surgical risks. Putting these animals under anesthesia definitely is a risky business. We really try to delay any kind of non-urgent surgery, unless we absolutely have to, until we can get some weight off of them. And something you don't think about, but when they come in to see us as a veterinarian, it's very hard to hear the heart on an animal that is, their body has just got inches of extra fat. It's very hard to try to palpate the abdomen and palpate for any abnormalities with that level of fat accumulation. And as we saw in those other studies, just their little spirits are just not there, diminished vitality. Just an X-ray photo of an arthritic, pretty severe arthritis and a canine hip joint. So about 20% of dogs that are examined every year we find have arthritis. And I know people will be shocked by this, but cats get arthritis very commonly. In younger cats, about 45%, and then once they're over 10, about 90% of cats have osteoarthritis. They just hide it better. They hide everything from us better. So we have to really kind of look for it. We have to rely on you as the pet parent saying, gee, I just don't see them up on their normal little perch as much as they used to be. Or maybe they're just not as active because they're in pain. And speaking a little bit about arthritis, so the most effective management strategy or treatment for arthritis in any species is going to be weight loss. And the reasons, it makes sense that if you're overweight and you've got arthritic joints, that's a more of a mechanical load on those joints. But what probably rivals that whole mechanical load with being overweight or obese on your joints is that, again, going back to these fat cells, which produce a lot of these really potent pro-inflammatory mediators that actually are really kind of contribute to the degradation of cartilage in that osteoarthritic process. So it's not just that you're putting extra weight or an extra load on the joints, but these fat cells are actually releasing mediators that create inflammation and contribute to the degradation of your cartilage. Doesn't take, you don't have to go from Kai of 100 pounds down to 75 to get relief and see improvement. Even a 10 to 15% weight reduction can really yield some pretty positive, noticeable physiological changes in these animals with arthritis. So lots of reasons why we're seeing so many overweight animals. I'm going to really kind of talk about diet and exercise, in a little bit more detail, but the social and environmental, a lot of that is what we do. Reproductive status, most of our animals in this country have been spayed or neutered, so that definitely affects the propensity to gain weight. Certain breeds of dogs we know also have an increased propensity for weight gain, and then the aging process can contribute a bit too. So diet, pretty much across the board, all species is probably one of the most important causes of being overweight and obese. I've kind of cut the words off there a little bit, but in the human realm, the #1 risk factor for disease and death now, it's been established, is the diet, our diet. There's even an acronym for it. It's SAD, and it is SAD, but it's the Standard American Diet. High fat, processed foods. 2016 Bureau of Disease and Injuries and Risks determined that our diet is what's killing us. And we don't necessarily have those kinds of statistics for our veterinary patients, our animal companions, but you can go into any pet store and this is kind of what you see. This poor little person way in the back is just sort of looking around. It's the pet food industry is a multi-billion-dollar industry that spends a lot of marketing coming after our emotions, and they're very successful at what they do, and they really target palatability in their foods, appealing to us, and that's how we tend to pick the foods for our pets, as on what appeals to us and what we think the picture looks palatable. But it's confusing, and it is kind of meant to be a little bit confusing, I think, to people. So one of the big reasons, in humans for obesity and being overweight is, surrounded by these highly palatable foods. And it's the same with our pets. So high palatability leads to overconsumption. Our table foods and treats that are given, homemade diets to a certain extent, they tend to trigger overconsumption in pets because they taste so good. And it's the same in people. In fact, studies have shown that people that have kind of long-term exposure, consumption of these highly palatable foods, processed foods, that's associated with a permanent increase in the size of the fat cells, the number. You don't get rid of them once they're there. They're there for good. And then, of course, body weight increases in body weight because of that. It's the fat, lots of things that are put into foods to make them taste good, but fat is one of the big culprits. That does tend to contribute quite a bit to palatability and to caloric density. There was one interesting study that showed that a group of dogs that fed a diet that's a little bit higher in fat, about 8% higher in fat, compared to a control group that was on a normal fat content diet for your average adult dog, gained significantly higher amounts of weight, even though the calories were exactly the same. So kind of an interesting study that showed the importance of fat in diet and what it can do. And I think, it comes back to we tend to just not be too aware of the calorie content in the foods that we're feeding our pets, and the treats, and the foods. And again, I go back to the pet food industry. It can be really tough to find the calorie content on a bag of treats or on the bag of food itself. It's usually in tiny little print, usually at the bottom of the bag. So it's sort of tough to find it, and I get that. You just have to really look. Sometimes it's not even on there, although they have gotten better about putting calorie content, particularly on treats. And we have no clue how most of us, how many calories our pets should be eating. Even if you decide, okay, I'm going to make this step, I'm going to go into the pet store and buy a food that says it's a healthy weight or it's for weight loss, they're not all created equal. They can range anywhere from, one statistic I saw was 270 calories per cup, and these are an 8-ounce measuring cup, all the way up to, more than twice that. And they're still allowed to call themselves a weight loss diet. So, super confusing. How we feed our animals, many of our pets will eat more if they're around other animals. So sometimes that's just sort of a comfort thing, but it could also be a competition thing. They might eat more quickly. Kids in the household, sometimes neighbors, doggy daycare, these are also sources of sort of sneaky calories or unaccounted calories that can be in our pets' daily intake. And then we feed to nurture them and bond with them and pacify them, actually. This is actually a picture I took. I'd asked her when we were working on a diet for her dog. And I said, just let me know everything that you feed, over the course of a few days. So she brought all these things in, and this is sort of the variety that her dog got. So she wasn't trying to be cruel or mean or anything like that, but she fed to nurture, and this is how she bonded with her pet. we tend to pacify kind of unwanted behaviors, attention-seeking behaviors, particularly with food. And inadvertently, we're rewarding that behavior. Affiliative behavior, so your cat comes and starts to kind of rub against your leg, and you think they want food, they really are just saying hi. They just really want your attention. They want you to pet them. So our tendency is to kind of reach for food right away. I call it an exercise deficiency. So diet and exercise, either overfeeding or under-exercising are the two main causes of the obesity, overweight epidemic in our pets. And usually it's both things. We just tend to live in a society that's getting more and more sedentary. That tends to be the norm now for most of our domestic pets as well as their owners. And I just thought this was classic. Only in America, using a escalator to get to the fitness center. So we know that exercise plays a huge role in helping to maintain a healthy body weight and to achieve a healthy body weight if you're overweight. About 30% of the body's calorie burning comes from just moderate levels of exercise. We also know that pet parents tend to overestimate or over-report how much their pet actually does exercise. I hear this a lot. We say, well, what does Fluffy do for exercise? And like, oh, we have a fenced-in yard, or we have an invisible fence. But you have to stop and think that Fluffy's probably not out there doing 20 minutes of continuous aerobic activity in that fenced-in yard when they're out there by themselves. They may run and chase a squirrel, they might run over here and sniff at something, or roll around in the grass, but they're not doing the continuous kind of workout that they would get if we just took them for a walk. So you kind of have to remember that just being outside in the yard does not equate with appropriate exercise. If they don't receive that exercise, then reducing calories is likely not going to be enough to compensate for that sedentary lifestyle. So it's really important to add in that exercise component to a weight management plan. Reproductive status, so neutering, drops that metabolic rate because of the hormonal changes that occur by about 30%. And that tends to coincide because most animals in this country are neutered at around 6 to 12 months of age, and that's exactly when they're beginning to go out of, to kind of grow out of their higher calorie growth needs from their food. So their need for higher calories as growing puppies and kittens is starting to slow down a bit, and then right at that same time we're neutering them, dropping that metabolic rate another 30%. So very, very common that we see a few months after neutering, and sometimes even sooner, these animals begin to gain excessively. Certain breeds, labs and golden retrievers, beagles, Cavalier King Charles Spaniel, that was my little Percy when he was a baby. And I did have to battle with him to I've never had a dog that was overweight, and he was a challenge because he didn't eat much. He would have wanted to, but yeah, it took a bit of work to keep his weight under control. But again, certain breeds, mixed breed cats, compared to like Siamese or purebred cats, have a tendency to gain weight easily. There's we don't really know why for sure. There's some theories on some of the dog breeds, but there's nobody that's come up with a good explanation of why these breeds tend to gain weight so easily. And then age. I tell people every day, I don't burn calories like I did when I was 20, and that's happening with our animals, but because their lifespans are shorter relative to us, these things tend to catch up with them earlier. So there is just a natural decline in lean body mass, and that reduces your metabolic rate, less metabolically active tissue. So the calories in a middle-aged animal may need to be even up to 20% lower than in that same individual as a young adult. And it could be exacerbated by health concerns if they can't exercise, if they have arthritis, or they had knee surgery, a number of reasons, or owners are not able to exercise them. So this, to me, is the exciting part. I want you guys to be your pet's supersized hero. it's something that is totally within our control. We have to recognize that we're the ones that buy the food, we feed the food, and we're totally in control of what they eat. And so we have the ability to really improve their quality of life by just being, on top of their weight. So it does necessitate a lifetime focus on their health and well-being. So we talked about, even as kittens, little kittens and puppies, how do we feed them? Are we, right off the bat, as soon as we get them, teaching them to eat free choice, or are we going to teach them how to eat meal feeding where it's a little bit more structured? Do we have multiple pets in the house and everybody's just kind of eating all together? Can we teach them to eat meal feeding away from each other so we have more control over who's eating what, and there may not be that competition to eat as much? It is a commitment, particularly when we're talking about weight loss programs, and does require that dedication to kind of keep up with it. But you saw in that video, the rewards are just amazing if you can. There is no cookie cutter instructions for every pet. They're all individuals, just like every person. The home environment is different, so you have to consider all of that. There's going to be non-negotiables. You can't just go in and say, don't feed any treats, don't feed any table food, because people can't comply with that. They're just not going to be able to there's a lot of emotions that are involved in feeding our pets, and so we kind of have to work with a plan that takes into account the human part of this. There's no perfect diet out there. So again, that team approach where it's the pet parents and the veterinary healthcare professionals and obviously the pet. I think the first step in all of this is recognizing that there is a problem. I find a lot of people, and I'm not sure whether they feel embarrassed or ashamed, or when you suggest that or let them know their pet is overweight, they kind of find that a little bit hard to swallow. And I think they might have this perception when the reality is this. So it's really taking a good hard look and listening to what your veterinarian says. If they are telling you that your pet is overweight, then take that as an opportunity to really make strides to improve the health of your pet. I'll just say right here that there's such a variation, a huge variation on calorie requirements from one pet to another, and specific diet recommendations, and on things we talked about based on life stage and health status, their breed, activity level, what the people in the household can do with this pet. So we can't just say every pet should eat this many calories and they'll be fine. That's going to be where you need to work with your veterinarian for that particular animal, because especially in cats, we can get into some problems if we just kind of arbitrarily say, okay, I'm going to cut the calories back by half. We can create a very serious liver disease called hepatic lipidosis. We can create protein and other nutrient deficiencies if we're cutting the volume of food we're feeding by too much of a percentage in an effort to try to reduce calories. So you really want to assess the current diet, what they're eating, how much they're eating, what's the calorie, the protein content of the current diet. Is it safe to use that diet as to try to get this pet to lose weight, or do we need to go to a weight loss food? Most of the time, that's usually what we end up doing. Some of the over-counters, prescription, because these diets are formulated to be low calorie, high protein, so we don't have to worry about the animal feeling hungry all the time, so it meets the satiety needs, and we're not going to run into deficiencies of nutrients because we're not restricting the volume as much. You want to really kind of talk with your veterinarian before you start exercise programs, particularly in the middle-aged or older pet, if you need them to lose weight. And I think this is probably the biggest thing I see is people just give up. They get frustrated, they try this, they try that, and they go for a month or two and they don't see any results, and they kind of give up. So if we have a team approach and everybody's working hard, we can avoid all things like this. So a few things that you can do. There's these body condition scores, very easy. I'll show you a couple of pictures of what they look like. They're readily available online, And they're a good way to kind of get at least a rough idea of dietary or body fat deposition. You want to look at the pet as well as feel the pet. So when we're looking for what we call that waist, you can see in that first picture there, the little arrow, you want to look from the top and you want to see that nice little waist there. You don't want to see kind of a rectangle look. And then from the side, that little what we call the abdominal tuck. So in pets that are putting on more and more weight, they start to lose that waist, they lose that abdominal tuck, and you can see that visually. When we feel them, you want to kind of run your fingers up and down the rib cage, kind of right behind the front legs, and you want to be able to feel those ribs relatively easily. You don't want to see the outline of the ribs sticking out, but you also don't want to have to feel through like an inch or two or so of insulation to get to those ribs. So that's a really quick and handy way, just looking and feeling. Are you starting to kind of see that waist square out? Are you starting to feel those it's starting to get harder to feel those ribs? And there's a number of these different scales, and like I said, you can find them online. This is a 1 out of 5, where 3 is your ideal. Just kind of talks about what you should be feeling and seeing. This is another one, it's a 1 out of 9 scale, where 5 is kind of your ideal. So they can be handy to look at. You do want to do those little assessments on a pretty regular basis, particularly as a young pet approaches adulthood, and then throughout their life. And then I think it's important to weigh them. You may not always get hung up on the actual numbers, but trends. If every time you weigh your pet every 3 to 4 weeks, it's getting heavier and heavier and heavier, that's a worrisome trend, and it's so much easier to prevent that weight gain, that obesity, if we can head it off before they get into trouble. So weighing your pet, letting your vet know, look, I've got these trends I'm noticing, or just bring them over. Most vets will have you come over, just to have a weight check with no appointment. So, some tips that you can start right away with helping with this. You want to eliminate or reduce all the treats or the extras that you add into the food. Now, I recognize that that's not really realistic. People are not going to completely, that are used to feeding with treats or extra, a little bit of chicken or whatever in the food, they're not necessarily going to stop that. So what you want to do is really try to minimize it and really kind of pick what the non-negotiable is. I have to give my pet this greenie or whatever, this chew toy every day, but we can negotiate some of the other things. There's some tips, if you are using, your pet is really food responsive, when you feed them their kibble for dogs in the morning, take out a small handful, put that in a jar, maybe sprinkle a tiny bit of like Parmesan cheese or something in there, let it sit for a few hours, and then feed them pieces of that kibble as a treat. For them, it's more how it smells and not how it tastes. So they think they're getting this really kind of meat-smelling treat, but it's food they would have eaten anyway. So you're stretching out the calories and not adding extra in there. Give them attention and play with them, exercise. They want your attention. They want that more than they want food, if we can just kind of understand that about them. If you have to keep them out of the kitchen or away from the dinner table when you're eating because of the begging, then do that. You can do things like using interactive feeding toys. For dogs, they have Kong, all kinds of different types that you put their food in. You can kind of put them off in another room and let them problem solve and figure out how to get the food out of it. It tends to slow down those really quick eaters that wolf the food down and then they're looking for more. It's mentally stimulating because they have to use their brain. They make them for cats. You can put kibble in there and let them bat it around and food falls out. So lots of different strategies like that just to help minimize some of the treats and extras that are going in. Feeding them smaller meals more often. Still talking about meal feeding, not just letting it out there for them to pick at. But believe it or not, breaking the meals into smaller meals can actually help directly with weight loss. So just this thing called mealtime thermogenesis, just the fact of digesting food will help burn calories. And so if you're doing that 3 or 4 times a day versus once or twice a day, That's going to help contribute to a healthier weight. And just wanted to kind of have a special little word on these guys, on cats. Free choice feeding tends to be the most popular feeding method. It's convenient for us, but there definitely is a higher association with obesity and being overweight if you're a cat. It's really hard to give them, and, you know, a lot of people have multi-cat households. It's really hard or impossible to know who's eating what. And when you're trying to, you know, got one lean, healthy body weight cat, another that's overweight, it's nearly impossible to try to diet that cat if you can't figure out who's eating how much. So trying to train them gradually to eat meal feeding is going to be in their best interest. Canned foods, we tend to recommend those a little bit more. They tend to be, you know, there's a lot of water in canned foods, so that it's satiety. They don't feel as you know, hungry if they're eating canned foods spread out throughout the day. They're less calorically dense because of that water content. It kind of mimics their natural diet a little bit more closely. They tend to be lower in carbohydrates. Cats are obligate protein eaters. They're obligate carnivores, so they didn't really evolve to eat a lot of these high carbohydrate dry foods that we use so commonly now. So, you know, feeding them maybe a little bit more canned if they'll eat it, introducing it to them if they haven't had it, just do it slowly. And then also with cats, they don't like change. They're creatures of habit. So you don't want to just decide one day, I'm going to take this food up and I'm only going to give you meal feeding. You want to gradually introduce a change in how you feed them, gradual changes in what you're feeding them to be safe and to have them accept it more. Mentioned these little interactive feeding toys. There's a website there, and I have it at the end too. I'll put it back up. All kinds of little puzzle feeders for cats, stationary ones for canned foods, dry foods, ones they can kind of bat around, sort of mimic that predator-prey behavior that's so strong and so important for them. But it is physically gets them moving. It's also, well, their emotional well-being. Ohio State University does a lot of research on cats and the link between stress and physical disease, particularly bladder issues with cats. And so if we can kind of recreate in the indoor environment, just allowing them to express their catness, you know, allowing them to kind of go after their food in a hunting pattern. If you're playing with them with a laser light, every couple of seconds where that light stops, toss a few pieces of kibble. They don't always have to just kind of walk up to their food bowl and eat it. And then they're like, now what? They get bored, and they will often overeat because they're bored. So we can kind of recreate what they would be doing if they were out in the wild. A lot of feral cats eat high-protein insects, so if you're zipping this light around, it's pretty frustrating for them to keep grabbing at it and don't have that tactile sensation. So it's another way you can even feed them some of their food that way. So yeah, like as I was saying, these interactive feeding toys or slow feeders for the dogs that tend to wolf their food down. These are food bowls that are kind of configured so they have to eat more slowly. So these things can help reduce begging if you let them go off and be busy with that while you're eating. And it's also a little healthier. They're not wolfing down their foods. I mentioned Kong, but there's lots of different interactive toys that you can look for. And then finally, there's more and more emerging technology on, you know, how do we kind of, in a multi-cat household, how do we get one cat to be able to eat and the others not eat the rest of that food? So they do have these little microchip feeders now where, based on the microchip that a lot of cats, especially adopted cats, have, it'll open up the food for that, only for that cat, and they can eat. So all kinds of things available to help. Very sneaky. And then finally, these exercise programs. So they burn calories. They're very mentally stimulating. Dogs live to use their nose, so we get them out there moving around, like the sniff. That's how they take in their world. And it can reduce stress. If you play with your cat, get your cat running around and zipping around the house, and vertical living space, letting them climb and do all those natural behaviors. That's a lot of stress reduction for them. We mentioned that predator-prey, so how can we mimic that sort of relationship with food for a cat to make it fun and to kind of really kind of speak to their natural instincts with eating. It's going to strengthen those muscles and improve range of motion. And you just, you start slowly. You don't want to jump into like a, 4-mile walking program in a dog that's overweight or has arthritis, or a cat that might have arthritis. So take it slowly. And you don't want to injure them or fatigue them, and then you're back to square one. So I have a few websites here that might be of interest. I'll leave it up for a little bit. Pet obesity prevention has been around for decades, really studying the problem, the obesity problem in our pets. And they have some information on their site. Indoor Pet Initiative is out of Ohio State University. Tons of good information on that, particularly for cats and how to really make that indoor environment enriched for them. Pet Foodology, good information there out of Tufts University. Wasava is excellent. They give you a lot of information on how you compare dog foods, cat foods, how to pick, a good nutrient pet food. And then petdiets.com is Dr. Remillard. She's a board-certified nutritionist. This is her online site that you can go to if you choose to have, if you want to feed just home-cooked diets. She'll balance it for you. You really have to be careful trying to do it yourself for lifetime feeding. A meal here or there of a home-cooked diet, probably isn't going to get you into too much trouble. If you just, feel you don't want to go with commercial pet foods, then I would really strongly advise having a consultation with someone like Dr. Remillard, and she can do it online for you. And that's pretty much all I have. Big topic, a lot to cover, so.
Ann, thank you.
Yeah.
Folks online, you can feel free to unmute yourself at this time if you would like to ask Ann any questions, or person in person here can ask. Or type in the chat if you prefer. Any questions for Ann?
My cats definitely prefer dry cat food, so I'd have to get some of those sneaky toys to put the canned cat food in. Do you think that would slowly?
Yeah, so a lot of that, and that's a big problem. Cats, if they were, probably, so the question was, her cat really just prefers dry food. And we call them dry food junkies. They just really can be tough. You'd think they would love these canned cat foods, but a lot of it is what they were exposed to as a kitten, probably before you even got them. And so that can kind of form their preferences for those textures. So it can, for some cats, just trying a variety of canned foods, different textures. We tend to prefer pate style. Some cats like those little pouched bisques or broths, which are mostly liquid or ultra pureed. They're not a balanced meal. They're more of a kind of a little bit of a treat or supplement. But you can start putting a little bit of that, and if they like it over time. Again, stress over time, because you're not going to do anything quickly with cats. Is just begin to drizzle a little over maybe a teaspoon of canned food, and see if we can kind of gradually introduce more canned into their daily rations.
So is it a bad idea then to have the dry cat food in a container self-feed? What did you call that?
Yeah. So the question was, is it not such a good idea to have like a self-feeding container for the dry cat food? And yeah, I think I would really try to kind of talk with your vet and say, what kind of calorie range am I looking at for my particular pet? And you'll find out in your cat food you're feeding how many calories are in a cup of that, and trying to introduce that in multiple meals throughout the day. Maybe they'll like it in some of these little puzzle feeders. If you only have one cat, you can even kind of take a few little pinches and put it around the house. 2 cats, yeah, it makes it harder, but kind of have them hunt for their food a little bit. But definitely it's a process of gradually trying to change to feed them meal feeding. It's also helpful because a lot of times you'll have a cat as they get older that develops chronic kidney disease, and we may recommend having that cat eat a more appropriate diet for kidney disease, and you've got another cat that's fine. and you really don't want that cat eating the kidney food. So it'll also help you, be control of who's eating what, so you're not feeding, a diet that's for a medical problem to a cat that doesn't need it. Yeah, but just take your time. If it takes you a month or so to do that, that's how long it takes. You don't want to drastically drop those calories on cats. So.
And there's a request, can you show the slide with the cat body types, sizes again?
Yeah, yep.
And then there's another question that came in after that.
Okay. That one?
Is that the slide, Margaret? Okay, I hope it is.
Yeah.
My name's Margaret.
Yeah, if it's not, just let me know, but I think that's
Yep.
what you're talking about. Yeah.
Okay, and then another question that came in, do felines get overweight in the wild, in their natural environment? When cats have enough natural food, do they stop when satiated?
Yeah, it's an interesting question. Definitely, I would have to say, there's always exceptions, but really doubtful that a feral cat or a wild cat is going to be overweight. First of all, cats expend a tremendous amount of their daily energy hunting for their food. So our indoor pets, and we do recommend they be kept inside, but what we need to do is, you can go to Ohio State's website and find out how are ways that we can make this indoor environment enriched so we can get them moving around more. But yeah, an outdoor cat that's kind of fending for itself is constantly on the move, hunting, eating small little packet protein meals. Their primary food source is going to be rodents, maybe insects, which are high protein little meals and not high fat, high carbohydrate diets that we tend to feed them, on top of all that activity that they have. They will not necessarily stop eating when they're, I'm talking about domestic cats, indoor cats, pet cats, and dogs. They will not necessarily stop eating when they're satiated. So, and that's a problem, particularly when we have all of these really highly palatable foods out there for our pets to eat. So, out in the wild, I think it depends more on their hunting skills and the availability of their food. So probably less of an issue for them to have the luxury of, I've got so many mice here, I'm just going to stop, eating.
Anyone else have anything? I've never seen a fat squirrel or a bird that cannot take flight, so the problem is humans?
The problem, it is. We are the problem. You can see from those statistics, we have a problem. So we share it, and they're a part of our family now, and unfortunately, we've kind of created this problem for them. I always say, they don't drive themselves to McDonald's, so we have control of what they're eating and how much they're eating, and so it's definitely a preventable, but that's the good part of this, is recognizing that there is something and there's a lot you can do about it, and taking those steps makes such a drastic improvement in their quality of life. And I hear it every day, many times a day, Doc, I just don't want them to be in pain. Well, here you go. Here's what you can do to relieve that chronic pain they're in. It does take a bit of work. I'm always hopeful and really thrilled when I see an overweight pet come in. If the owner is going to be committed to doing this, because I know there's not a lot we can guarantee when we're dealing with medical issues, but I can guarantee you that your pet will be more comfortable, will be healthier if we can get them to slim down. It doesn't even have to be down to an ideal weight. Again, we were talking about 10 to 15% weight reduction can really impart some positive physiological changes in them. So don't worry about, this is going to be a cool, drastic weight loss diet. It's going to be a kind and gentle way to get them to a healthier weight and to live longer. That's what we all want. We want them with us longer because we love them. It's part of the reason they're in this problem. We kind of overlove them, but there's a solution to it.
Question, my slightly overweight Chihuahua Terrier mix does a lot of frantic licking of furniture when he is laying on it. I am wondering if that may be due to anxiety and boredom. Would playing more with him maybe help both his weight and this habit?
Yeah, I think definitely going to help the weight. You know, walking is a really good activity for dogs in particular, obviously. Again, taking in their world through their nose, that's pretty much how their brain is wired to take in the sense that they encounter when they're outside. So it really makes them happy to be out there using their noses and burning some of those calories. And as far as the licking goes, so yeah, I think definitely it can be an attention-seeking behavior. Always you want to make sure there's not like a medical reason, you know, if they have really bad dental disease, which Chihuahuas tend to have, if there's any discomfort in the mouth or anything like that. But if all of that is, you know, medical things put aside, then it sounds like it could be an anxiety-based behavior. And I think a lot of times our dogs are anxious because they just are sedentary. They're not doing enough. They're bored, and they kind of figure out, what am I going to do to entertain myself? And sometimes it ends up being behaviors that are almost like compulsive behaviors or destructive behaviors. So absolutely, I would just begin to, you know, create little games. You know, be creative, hide little pieces of a kibble under a towel and, you know, have them find it, or in your hands. You know, create little games like this. It's going to help mentally stimulate them. We know cognitive dysfunction of pets as they're aging. One of the main ways we can help stave that off or make it less is to just teach them new little things to do. So keeping their brains active and definitely their bodies active. So yeah, I would definitely encourage you to experiment and see if you notice some of that behavior, you know, reduced a bit. It may not stop completely if there is some anxiety there, but it might. Terriers are tough. Their minds are always going. They're busy, 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 and they need jobs, and they need to do stuff. So.
Okay. Anything else from anyone? Okay. All right. Thanks so much, Ann, for putting this together and sharing this information with us.
Yeah, hopefully it was informative and got you all inspired to keep the pets lean and get them there if they're not. So you're a supersized hero.
Thank you. All right. Good night, everybody. Thanks for joining us.